Good morning everyone and welcome once again to Wacky Wednesday. It's been 27 years since I've been practicing classical holistic homeopathy, and there have been certain questions which have been asked to me recurrently. One of them is, hey Dr. Priya, you're an Indian, do you practice Ayurveda? The second is, hey Dr. Priya, does homeopathy come from India? So I decided why not do a Wacky Wednesday to explain these two queries. So you see, dear friends, homeopathy originated in Germany in the 18th century. It was discovered by a physician, Dr. Samuel Christian Hahnemann, and therefore it got popularized in the Western globe, and later it even came to the Commonwealth countries. In India, around the same time, there was a French doctor by the name of Dr. Honigberger who treated the Maharaja of Punjab, Maharaja Ranjit Singh. And then he went to Calcutta and started practicing there and helped a lot of cholera patients, so was called as the cholera doctor. It's the British who popularized homeopathy all over India, sometimes even at the cost of Ayurveda. Yes, they were our invaders. But the essential philosophy of homeopathy is very similar to the essential philosophy of India and Ayurveda. So homeopathy, which was brought in by the invaders, took roots in India and has flourished, and today some of the best homeopaths of the world come from India. Yes. So the essential philosophy of homeopathy believes that any disturbance or disease starts at the level of the spirit, then percolates to the level of the mind, and then gets expressed at the level of the body as signs and symptoms. And it is the skill of a homeopathic doctor to decipher these signs and symptoms and come out with a perfect remedy. Yes, when homeopathy started getting popularized, there were two kinds of people who popularized homeopathy. There were the lay people who started studying homeopathy as a hobby and started many charitable clinics, and they did a lot of good work. But then there were physicians, mainstream doctors or mainstream allopaths who got converted to homeopathy and started practicing homeopathy. This credit goes to Dr. Mahendra Lal Sircar from Calcutta. He popularized homeopathy among the mainstream doctors. So somewhere around 1973, the government of India established the Central Council of Homeopathy to look into the matters regarding homeopathy. As time passed and homeopathy became more and more popular, somewhere in 1983, the government of India again started university degree courses in homeopathy. These courses were unique in the sense they were very, very integrated. They brought the clinical knowledge to homeopathy. Yes, these degrees are BHMS, which is what I have, Bachelor of Homeopathic Medicine and Surgery. Now, what does this course entail? So in the 5.5-year university degree course, we do everything from anatomy to physiology to general medicine to gynecology to surgery. Yes. In being a Bachelor of Homeopathic Medicine and Surgery, you study everything that an MBBS doctor studies. Only in the 5th year, where they study their pharmacopoeia, we study our materia medica. Now, therefore, we are medically trained homeopaths. But even today, there are medically non-trained homeopaths. What's the difference between the two? The knowledge of homeopathy is same for both. But a medically trained homeopath has further clinical knowledge, in the sense his diagnostic skills are better than the medically non-trained homeopath. Therefore, in the western side of the globe, a lot of countries have now made it compulsory for medically non-trained homeopaths to either practice with a mainstream doctor, general practitioner, or with a medically trained homeopath, so that there are no diagnostic errors. Now, what do you mean by that? Let me explain further. Let's say there is a asthmatic child who comes to you. The oxygen levels of asthma children drop very fast. Sometimes you have to pick up these clues. If a doctor is medically trained, he is able to pick it up and act quickly to do something to increase the dilation of the bronchi so that air goes in and the oxygen levels go up. See, there is no fight between this pathy and that pathy. Sometimes you do need in emergencies you do need mainstream medicine. There is nothing wrong with that. There is no fight even among traditional medicine. So you see, traditional Chinese medicine comes from China. They use acupuncture, acupressure as well. Traditional Ayurveda comes from India, which uses the Indian herbs. Unani comes from the Middle East, and Jamu comes from Indonesia. From India also comes another system of medicine, the Siddha system of medicine. Many a times people feel that there's a fight between all this. Homeopathy from Germany, Ayurveda from India, TCM. No, it's not like that. It is the patient who is most important. Sometimes patients tell me that they are not able to have the very, very bitter TCM or Ayurvedic medicines. They would prefer me to give them the homeopathic medicines, because you all know homeopathic medicines are sweet and they are very easy to carry around. But they would prefer the Ayurvedic massage or the TCM acupuncture, and I'm absolutely okay with that. It is together we can work towards the betterment of our patient, can't we? Yes, that is the whole idea, because all traditional medicines believe in the trinity of the mind, body and the spirit. Yes, they believe that disease is only when there is an imbalance in the trinity, and a doctor or a physician does not need to take over the human system. The human system is fully capable of rectifying itself. Traditional medicine believes in supporting the human system to help it on its way to recovery. Now, traditional doctors are not miracle people. So people, when they come to traditional doctors, expect miracles. That's not right. If your illness has taken 3 years to develop, you at least need to be patient for 3 months for you to start seeing any recovery. Yes. At the same time, you also need to be perseverant in your treatment. 2 key things which are needed in homeopathy are patience and perseverance. Only then will you start seeing results. Of course, it's even valid in acute medicine. Homeopathy has great results even in things like fever, sore throat. Right now I am having one and I'm taking my own medicines. I can even tell you which one. I'm taking Heparosulf. Yes. Now these medicines can give quick effect. The fever can come down as fast as a Panadol would bring it. And I'm not joking. If the illness has taken 3 days to recover, you can give me 3 hours to show you recovery. Of course, that also means you have to do lateral things, like you have to manage your diet. You have to do other complementary things to benefit you. If you have a bad throat and you go and eat an ice cream and say, hey, Dr. Priya, your medicine is not giving me relief. Well, I always say, I'm not a magician. We've both worked together, the patient and I, to help the patient recover. Yes. So it is 50% you, 50% me. Together we are going to work towards recovery. Now, what is the difference between homeopathy and other traditional medicine? A little bit on that. Other traditional medicines use the herbs in their essential form, which means, let's say for instance in TCM they use ginseng root. The ginseng root is used as it is. We also have a homeopathic ginseng. The homeopathic ginseng looks nothing like a ginseng root. In fact, it's either in a liquid form or in those little sweet globule forms. That is because in homeopathy we take the ginseng root and energize it by a process which is known as potentization, succussion or trituration. Yes, now that's a topic in itself which I'll address some other time. Similarly, in Ayurveda, let's say they use onion, for which I had done a Wacky Wednesday last time. Well, in homeopathy also we use onion as one of our medicine, and it is called Allium cepa, and it is used to treat exactly the symptoms a raw onion when you chop produces. Your eyes water, your nose leaks, kind of like flu. Well, Allium cepa is one of the best medicines for flu. But the medicine is again in its energized form. So if you take a bottle of Allium cepa and smell it, or the pills, they have nothing to do with the smell of the onion, because it's all in an energized, potentized form. That's the classical difference between all other traditional medicines and homeopathy. In that sense, because of its energization, homeopathy is taken in very little pill forms, very small quantities. A lot of times when I ask the patient a whole lot of questions and a case taking of 1.5 hours, and then I give a teeny mini bottle of medicine, patients look at me and say, only this much? Well, it is energy packed bottle of medicine, and therefore it requires a lot of good care and handling to retain its energy. Now again, that's a topic by itself which I will address some other time. So I think I've clearly explained to you all how and where homeopathy started and how and where it settled in India. If you all have any questions further related to homeopathy, do reach out to us and we'll be more than happy to answer them for you. On that sweet note, here's wishing you health and happiness. Thank you.